with Health Innovation Media, broadcasting live from Health 2.0. And it's my pleasure this afternoon to have with me an incredible entrepreneur, Bettina Experton. Of course, I'm probably not saying it with the proper accent. And she is the founder and CEO of an incredible company called Humetrix. And Humetrix has developed the first ever, I hope I get this right, blue button compliant app that enables patients to be able to download their data and have it presented to them on a smartphone in a user-friendly way, so they can share it, either have it for themselves or share it with their friends and family, or even more important, share it with their physicians. So Bettina, I thought we should start out by having you tell people, what is this blue button thing? I am wearing one, by the way.
Good for you. And I do
and
too.
You are too.
Even the total blue colors, right?
Yeah.
Embracing the concept, I think we are at a time in history here in healthcare where the individual, the consumers, now can have control over the healthcare. And what does that mean? Being informed about your health status, informed about what that physician put in your chart, be able to communicate that information in an effective way, so you prevent problems. It's about your safety. And blue button is...
So this becomes my medical chart?
It becomes your medical chart in your own hands.
In my own hands,
so
right.
You can review it, you can be informed, you can see if there is any error in accuracies. Maybe that what you communicate to your physician was not translated right when it came to the electronic format, he didn't hear you right. He couldn't understand you with that strange French accent of mine. And so, to have a direct view at our health makes a lot of sense, and it can save lives. So Blue Button is about giving that degree of control to all of us. And so when you see this logo, this Blue Button logo, it means that if you sit on a portal, on a patient portal of your health plan, of your healthcare providers, you can download your health record. And what my company did as soon as this program came to be is that we embraced that concept and we made that blue button really practical and usable. And what does that mean? If it is to have your chart in your own hands, it has to be on your smartphone or your tablet. It cannot be sitting on your PC at home, right?
Right.
You're not going to carry your PC or even your laptop in your doctor's office. And when time is of an issue, you have 5 times to tell your story, to get your physician to interact with you, a tap of a button to pop that information, your list of medication, where you have been, the name of your physicians, how to contact them, the test you have, so you will not repeat that costly test. And
so this means, sorry for interrupting, but this, it sounds like if I'm listening to you, this means that if I move to a new city and I get a new doctor, I don't have to go through that process of having him or her request my medical records, maybe pay for my medical records, have them Xerox or fax. Instead, I can just walk in and say, "Hi, doc, this is me. This is exactly everything right. You need to know
but
about
I
me."
would argue, Pat, that in healthcare, you move in a different city every day. You may be living in a given city, but you need to access, typically you access care from different places. Yes, in some instances, if you're in the Kaiser healthcare system, everything is there for you, but not everyone in the Kaiser-like environment, and healthcare is very piecemeal, it's very fragmented. And so it's critical for us to keep that precious information of where we have been, what was done to us, what was prescribed to us from different places and different doctors is in our hands at all times. This is about Blue Button. Make it mobile. This is about the application we developed, which is called Blue Button.
And so when I was a practicing emergency physician, and we would get people who come from out of town, which is what you're talking about,
yes.
And they get sick and they ended up I was with Kaiser, but we would get non-Kaiser members. We wouldn't have access to their records. The thing that I wanted the most was that last EKG.
Yes.
Do you have images? Are we able to put chest x-rays and EKG images, or is it really just lab results and diagnoses and medications?
So, this smartphone, this tablet is an extraordinarily powerful computer. It has all the storage you need, and it has all the computing ability you need to view that images, to view a video, to make a recording of your interaction with your physician, and to pop that information to the next physician you see. So Blue Button is about easy access to your health record in whatever shape and form it comes. So it can be text, it can be lab results. So when you're a veteran, your Blue Button health record is about to include X-rays. But today, the Blue Button health record veterans can access and download on our iBlue Button Veterans app include test results, and again, it can include it would include down the line images, and then you can add to your own Blue Button record and your data hub on your phone. You can add what is relevant to you. You can take a picture of a skin lesion you have this morning, and which may not look exactly the same when you visit the dermatologist a week down the line, and so forth. That can be in your mobile hub. So extremely powerful, I think, tool which can give us that control of our healthcare today.
Well, we've been having a lot of conversations with people who are involved with end-of-life care. And I know that there's a company that's also Blue Button compliant. I don't know if that's the right word, Blue Button compliant, or playing in the Blue Button
Yes.
Playground, called My Directives. And I've actually used that. I can go in and have a real time, I can continually update my advanced directive preferences,
Yes.
and include really personal information about myself, like, you know, what my religion is, what kind of things make me happy, what I'd like to have happen to me in the hospital, even what kind of things I'd like to happen to me after I
Yes.
go to the great beyond.
Yeah.
Are you integrating with, or do you have that capability, or how would I be sure that if I filled that out and I'm really happy with another Blue Button app, that information would get integrated into the iBlue Button? Is that something that you're doing?
So iBlue Button is your mobile hub for all your healthcare, and when we speak about controlling our own healthcare and our destiny, I think this is about planning as well. It's about planning what we want and we do not want. So I am a big believer of the use of advanced directives, I believe that in iBlue Button for Medicare beneficiary, we provide links for folks to find about how, what advanced directive is available to them. Those advanced directive forms vary by state. That's a feature which we will be glad to embrace within the iBlue Button app. And
I mean, it
it's
would be
part of
really,
that concept.
it'd
Yes.
be fantastic
Yeah.
if something happened to me and iBlue Button becomes sort of the app of the land,
Yes.
which I'm sure as an entrepreneur you hope that happens, that a physician or my family or whoever gets a hold of my phone, I'm incapacitated,
Yes.
and they could get not just my medical records, but they could get all that other information as well.
We say that your phone is your lifeline, where everything's relevant to your daily life, but also everything critical to your life can be there at your fingertip. In terms of advanced directive, it's you have to make it real and legalistically valid. So it has to be a signed form. That signed form can be scanned and saved on your phone, and it can be in your iBlue Button data hub. So we talked about pictures, images, X-rays, and your signed advanced directives can be right there at your fingertips. Yes.
So, Bettina, do I
Yes.
pay for this thing?
Of course you have to pay for that.
How much do I pay? What do you mean? Of course I have to pay. I'm used to getting everything for free.
Yes, well, I think as an entrepreneur, to make a difference in this field of healthcare, we want to do it for many, and that application has to be maintained. It has to be kept up to date. It has to be enhanced by features such as this advanced directive utility. So how do you get iBlue Button today? You get to download it for free from iTunes or Google Play. You get to use it, experience it, see if it works for you, and see how you can make use of it. And then as you use it, you have a choice. If you want to download up to 5 times any of those Blue Button records to be right there on your phone, you pay $1.99, And if you want to download...
So it's really expensive.
$1.99.
Right.
Yes. In the scheme of things, it may be less than an antibiotic pill, right? And,
much less.
And that copay you have to pay for. So $1.99 for 5 downloads of Blue Button records, or $7.95 for 25 Blue Button downloads. And why 25? One of the great utility of Blue Button is to make use of that Blue Button program at Medicare. We take the Medicare Blue Button and we translate 3 years worth of your claim history at Medicare into a usable, actionable record right on your phone. And as it turned out, when you are covered, when you reach that 65 years of age, where you can benefit from the Medicare program, on average, a Medicare beneficiary visits 25 different encounters, medical encounters in a given year. So in fact, the number is 23.
Oh, okay.
So that's why the choice is 5 downloads or 25 downloads, so you cover those 25 different encounters in a given year. So you may be out of pocket for $7.99 per year.
All for having
to
your
cover
entire
your care.
medical
Yes.
record.
Yes.
Oh, that's really
Yes.
fantastic.
Yes.
And so, Bettina, we're kind of running out of our time together, but I always love when I'm talking to a great entrepreneur like you are, to ask you a little bit about your journey. I mean, people can obviously tell that you are from France, and I happen to know that you were a physician in France.
Yes.
And my question to you is, how did you go from a doc in France to an entrepreneur in Southern California? What was your journey?
So first of all, I don't think I've achieved that greatness status. I think when this Blue Button will be in the hands of, let's say, 100 million plus Americans, maybe you could use that.
Okay, well, we'll have you back then.
But I think as a young physician who came from France to do a sabbatical, I was an oncologist, and my dream was to come on this American land where all the most exciting research was being published, and so I wanted to see it close by. And then, as it happened to a few us immigrants, I came here in America and I never returned because something struck me that I could do even more here than I could do in France. And what I learned is that here, when you apply your passion and your drive, and you learn new skills, which you have a right to, even as a physician, you can learn about computer science, as I did. You can learn about public health and epidemiology. And I did discover this field of IT. And yes, I could start an enterprise with my sweat equity and my hard work. And I did work as an emergency physician, as a public health doc, learning what healthcare meant for Americans, what could be done, what should be done, and the environment is so extraordinary to let you succeed. So it has been an exciting journey.
Well, I want to thank you very much. It's been wonderful having this brief conversation with you. And I love the Blue Button. I love what you're doing, and I really look forward to watching you as Blue Button does take off and become, as like Gia Riccardi from ONC says, a movement. And everybody's talking about it, everybody wants it, and everybody's doing it. So
if I may, have one additional word about, yes, Blue Button is a movement. I would say that it's a revolution where every American now can have control over their health care. And as such, because we are transforming the healthcare system from the ground up, as it should, when consumers for their health care become informed, engaged, and are true actors, a number of companies have decided that the time was right to take that Blue Button message public in a big way. So we are forming a coalition of tech companies, of big consumer brands, patient-facing organizations to promote this Blue Button concept and movement. And so we are going to embark in a national campaign in partnership with the federal government. So I would encourage any entrepreneur, small and big, any established company, to take notice and to join that coalition.
And how would they do that? Is there a URL they can
So I guess
visit?
at this point,
or they call you personally?
They can contact me, and We will make an announcement in the next few weeks, and this coalition will be organized with a name and a website and a phone number to give, which is not there yet. But please call me, join that movement, and be part of a real revolution.
Okay, fantastic. So I'm just going to close by saying how they would do that. They can go to the Humetrix.com page and fill out a contact form, or what's the best way for them to do that?
So the best way will be simply email me. So my email is bexperton@humetrix.com, or look on Twitter. I have an account there, or at Humetrix. So I mean, there will be ways to find me.
Okay, you won't be hiding.
I don't think so.
Okay,
Yes.
fantastic. Well, that was great, Bettina.
Thank you.
I wish you luck, and thank you very much for joining us. This is Pat Solver at Health Innovation Media, broadcasting from the 7th Annual Health 2.0 in Santa Clara, California. Thank you.